Hi, are you pregnant and wondering how many scans do I need to do in this pregnancy? Maybe you've heard about the dating scan, the anomaly scan, the growth scan, or even the Doppler ultrasound scan, and you're wondering, do I need to do all of these scans in pregnancy? So in today's video, we're going to explain the types of scans that are done in pregnancy, when they are done, the things we look out for in each of these scans, and of course, whether you need to do all of these scans in pregnancy. So welcome to the Obstetrician's View, where we give you clear, calm, evidence-based information on pregnancy and women's health. So let's start from the basics. A pregnancy scan, known as an ultrasound scan, uses sound waves to create images of your baby and the structures in the womb. So unlike the X-ray, the ultrasound scan does not use ionizing radiation, so it's a lot safer than an X-ray in pregnancy. An ultrasound scan will be used by your healthcare provider to determine the location of the pregnancy, whether it's in the womb or outside the womb, when we call it an ectopic pregnancy. It will also help us to determine how far gone the pregnancy is. Also helps us to assess the growth of the baby, whether the baby is growing as appropriate for the age of the pregnancy or not. We also get to know about the fetal heartbeats, that's the heartbeat of the baby, the location of the placenta, the amount of water around the baby, known as the amniotic fluid. Depending on the age of the pregnancy also, it may be possible to determine the gender of the baby. So very importantly is the fact that scans are done for different purposes, and not every pregnant woman needs every type of scan. One of the earliest scans you will have in pregnancy is what we call the early pregnancy or viability scan. This scan is usually done in the first trimester of pregnancy. Most women would have even done this scan before presenting to a hospital to say that they are pregnant. Sometimes a doctor will request this scan if there are uncertainties about the date, or the woman is having abdominal pain or vaginal bleeding, or there's a history of ectopic pregnancy or repeated miscarriages. We may want to request for an ultrasound scan, or maybe there are other reasons for assessment of the pregnancy in the early stage of the pregnancy. So this scan helps us to assess the viability of the pregnancy and also tells us whether the pregnancy is developing as it ought to. Depending on how early the pregnancy is, this scan may be done through the abdomen or through the vagina, especially when clearer images are required in the pregnancy to clear some doubts or for whatever reason. Basically, don't be alarmed if your doctor says we need to do a scan through your vagina. Another important scan, usually in the first trimester, is the dating scan. So like the name suggests, this scan helps us to know how far along the pregnancy has gone, and also helps us to establish the expected date of delivery, especially when there is some doubt about the last menstrual period. So sometimes this scan can be interwoven with the early pregnancy scan, depending on when a pregnant woman presents to the healthcare facility. So accuracy in dating a pregnancy is very important, because most of the decisions that will be taken later in the pregnancy are usually dependent on the age of the pregnancy. This is one of the reasons why booking early for antenatal care or registering for antenatal care early on in pregnancy is very important. So if you haven't done an ultrasound scan, or you have issues with the dating of your pregnancy, you may need to visit your healthcare provider to determine an appropriate time for an ultrasound scan. Between approximately 10 to 14 weeks, depending on the specific screening protocol or program in the facility where you're being supervised, you may be offered an early first trimester assessment. One of the components of this assessment is an ultrasound scan measurement of what is called the nuchal translucency. This is basically the measurement of the fluid space at the back of the neck of your baby. It's usually used as part of the screening for certain chromosomal abnormalities such as Down syndrome. However, it's important to understand that it is a screening test, not a diagnostic test. So depending on the results that is gotten, your doctor or healthcare provider may advise further screening tests or diagnostic tests to determine or to make a proper diagnosis of whatever is suspected. So basically, the fact that you have an abnormal nuchal translucency scan does not automatically mean that your baby is going to be abnormal. This is very important, Now we come to one of the most important scans in pregnancy. That's the anomaly scan, or some people call it the mid-trimester anatomy scan. This scan is usually done between 18 and 22 to 24 weeks, depending on the local practice. So during this scan, a detailed examination of the baby is done. Okay, the baby structure, or what we call the anatomy of the baby, is done during this scan. So in doing this scan, the sonographer or the doctor who does the scan looks at the brain, looks at the the spine, the internal organs of the baby, the heart, the lungs, the kidneys, okay, the limbs of the babies, the bladder, the abdomen, and other important structures of the baby. While doing this scan also, the placenta can be looked at to see if there are any abnormalities with the placenta. And then the volume of, the fluid is also checked to be sure that everything is fine. Sometimes if the baby is properly positioned and maybe the parents want it, the sex of the baby can also be determined during this scan. So, but it's important that you know that the anomaly scan is not a guarantee that the baby has no abnormality. Some abnormalities with a baby can be detected later in pregnancy, even though the scan at this age of the pregnancy does not show those abnormalities. Some abnormalities may only become apparent later in pregnancy. So basically, a normal scan is reassuring, but it doesn't exclude every other abnormality that could occur with a baby or with a fetus.